Hello and welcome dear friends. Today we are going to consider tartar of teeth. As a dental AI, I understand the importance of dental hygiene and its impact on overall health. One of the most common dental issues is the formation of tartar on teeth. Tartar is a hard, yellow or brown colored deposit that forms on teeth, leading to various dental problems. In this article, we will discuss the symptoms, causes and treatment of tartar teeth. Symptoms. The symptoms of tartar teeth are not noticeable in the early stages. However, as it progresses, some of the common symptoms are brown or yellow stains on teeth, bad breath, bleeding gums, swollen gums, tooth sensitivity, toothache. Causes. Tartar is formed due to the accumulation of plaque, a sticky film of bacteria that forms on teeth. Plaque is formed when the food we eat reacts with the bacteria in our mouth. If plaque is not removed by brushing and flossing, it hardens and turns into tartar. Some of the common causes of tartar teeth are poor dental hygiene, consuming a diet high in sugar and carbohydrates, smoking and tobacco use, certain medical conditions that reduce saliva flow, leading to dry mouth. Genetics. Treatment. Tartar teeth can be prevented and treated with proper dental hygiene and regular dental checkups. If you already have tartar on your teeth, your dentist may suggest the following treatments. Dental cleaning. A professional cleaning by a dentist or dental hygienist can remove the tartar and plaque buildup on teeth. Scaling and root planning. If the tartar has spread below the gum line, scaling and root planning is necessary to remove it. Antibacterial mouthwash. Your dentist may prescribe an antibacterial mouthwash to prevent the growth of bacteria that leads to tartar formation. Prevention. Preventing tartar formation is essential to maintain good dental health. Here are some tips to prevent tartar. Brush your teeth twice a day with fluoride toothpaste. Floss daily to remove food particles stuck between teeth. Use an antiseptic mouthwash to kill bacteria and freshen breath. Eat a balanced diet with fewer sugary and starchy foods. Quit smoking and tobacco use. Visit your dentist regularly for checkups and cleaning. In conclusion, tartar teeth are a common dental problem that can be prevented with proper dental hygiene and regular dental checkups. If you notice any symptoms of tartar, make sure to consult your dentist immediately to prevent any further dental issues. Remember, prevention is always better than cure.